Representative Martin Heinrich joins us in the Newsplex today to talk about the health care reform bill. Thanks for being here.
My pleasure. It's great to be back.
Yeah, the House did pass it this weekend after a lot. I mean, let's talk about the battle that this took to get this done, where there wasn't even a consensus among New Mexico's delegation.
Sure.
Harry Teague did vote against it.
That's right. Yeah, there were two of us who voted for it, one against it. And, you know, when you're talking about something as big as this, about reforming our entire healthcare system, in many cases taking on vested interest in the insurance companies and other places, it's not easy. But we got our work done on Saturday night, and now that work moves on to the Senate.
Talk about what's in this bill that you liked since you voted for it.
You know, one of the fundamental things that's really important is people cannot be turned down anymore for having a pre-existing condition. So if you have diabetes and you lose your job and then you get a new job, you can't be turned down for insurance because you have a pre-existing condition. That's absolutely huge. We have some great things for New Mexico in terms of fixing Medicare reimbursement rates, including reauthorizing the Indian Health Service after 10 years. So in the end, this is a much better bill for New Mexico than it was 5 months ago.
What about the public option? It is in this bill. Many in the Senate have been very critical of that. That
Sure.
seems like that's going to be the sticking point there. How much of a fight was there in the House over that?
Less in the House. I think we would have a harder time passing a bill without the public option. We saw public support really grow for that as the debate continued, and I think that will eventually have some impact on the Senate too. The national polls in particular show really strong support for the public option, sometimes in the 70% range now. I think it's going to be hard to get a bill out of conference that doesn't have some sort of public option.
Well, that's what I was wondering, if in the Senate, if they pass a bill with no public option, then we come back to the table, both houses have to vote again. What are the chances? You think it's leaning more towards that, yes, it will stay in there?
I'm optimistic it'll stay in there, in part because the majority leader in the Senate supports it. We'll have a conference of both House and Senate members. I know how committed the House members will be to it. I think in likelihood a large number of the Senate members will be too. We may have a better chance in conference than in the initial Senate bill. I never try to predict what the Senate will do. We'll just have to see where they go and try to work with them in conference.
And this is obviously hard to predict. I mean, how long are you guys talking that this is going to take till this is a done deal, completely approved?
You know, I'm not going to make a guess for how quickly the Senate will move, but I think we're coming to the end of this now, and I think hopefully this will all be said and done by the middle of January at the latest, hopefully before Christmas.
Okay, we'll see. Thanks very much. We appreciate it.
Great to be here.